Hello, and welcome back to Behind the Desk, where we do an in-depth with CEOs, VPs, business leaders, and innovators around the world. Get ready, because we're having an exciting podcast today. Are you ready to tackle the real roots of weight, hormone imbalance, and struggling with energy? If you've ever felt rushed, dismissed, or unseen in the traditional system, you'll want to hear how our guest is actually flipping the script with deep lifestyle first care that actually fits real life. Today, you will hear from our guest here about exactly that. May I introduce to you our guest, Sarah Omodele.
Hi, how are you?
I'm wonderful. Please just give us a little bit about who you are, your position, and your company.
Sure. Well, I'm Dr. Sarah Omodele. I'm a nurse practitioner. I'm the owner and founder of Unlayered Health and Wellness. And the goal of Unlayered Health and Wellness is to help women, especially who are navigating hormonal and metabolic changes, feel balanced, feel better, and feel connected so they can feel their true self. So that's kind of like my passion and what I'm about in terms of Unlayered Health and Wellness.
I love that. Tell me, Sarah, before Unlayered Health and Wellness was even an idea, what was happening in your life or career that planted the first seed for this business?
Sure, it's a great question. So, it was a journey. So I've had I have over 20 years of experience as a nurse and then as a nurse practitioner. I worked a lot in cardiology. I did some internal medicine and GI, but a lot of my career has been around cardiology. So over time, I just kind of got this dissatisfaction. I felt like I needed to do more. I felt the patients were not getting better. They come in, they get, cardiac caths, they get stents. We start them on medication, and they keep coming back. Their cholesterol is always elevated. Their blood pressure is always elevated. There's always something. So I just felt like, you know what, I wanted to leave the acute setting because I worked in a hospital most of my career. And I wanted to do more. I wanted to go out there, see if I can prevent patients from getting into the hospital, see if it's more or less something else. So I kind of juggled between, should I go back to medical school and get more education, or should I just get my doctorate? And I spoke with one of my mentors, and he said, will I do anything different that I'm doing now as a nurse practitioner? I said, no. Okay, so if you want to be a doctor and learn more, why don't you just get your doctorate in as a nurse practitioner in nursing practice? So I went ahead and got my doctorate in lifestyle medicine, focusing on lifestyle medicine, where we realized that these chronic illnesses, diseases can be reversed, managed, or even prevented by just changing your lifestyle. We go through, the framework of the program or of lifestyle medicine is 6 pillars. We're talking about diet, exercise, sleep, avoiding harmful substances, social connection, things like that. Those things are important, and stress management. So when I learned all that, incorporated it into my own lifestyle, that was actually during COVID. I was in school then, and I saw how I lost weight and everything got better. My husband is also incorporated plant-based diet because that's one of their foundation. He reversed his prediabetes, his cholesterol went down, it was off his blood pressure medication. I was like, this is it. So this stuff works, Wow. So then during that time also I was like 38, 39, going through, I just felt that disconnect, as I said, but I didn't realize in hindsight, looking back, it was more like that midlife perimenopause or the beginning of it, where women usually get that feeling of dissatisfaction or disconnection, feel like they want to connect back to themselves. So with all that information and now me going through it myself, I realized that I can give a lot to women. I also take care of men because the women bring their spouses, or other guys just hear what I have to talk about and they come to me. But because I understand what women go through, the hormonal swings, the metabolic changes, the emotional and the mental juggling and things like that. So that's how I develop Unlayered. And Unlayered just meaning unlayering, and getting back to your true self, unlayering and getting away from all the hurt and the pain or whatever you've been holding in that you've kind of suppressed, and then it's now leading to all these chronic illnesses. Let's unlayer it. Let's get rid of it. Let's get down to the root cause so that you can stop feeling better and be a true version of yourself. So that's how, Unlayered just kind of came about. So I really focus more on holistic, integrative, a little bit of functional in there, and just trying to have more time. I spend 30 minutes to an hour with my patients, and I'm talking about, their goals, their dreams, their why, what are your potential, just a lot of things move together. I'm a woman of faith, so my background, I'm a Christian, so I usually incorporate that. I'm not heavy on it because I want to respect everybody's background, but that's kind of my core and foundation. So when a patient speaks to that, I connect with her and I say, and I look for things that will connect her faith to what she's going through, and just providing that holistic approach and the care to my patients.
I think too many doctors nowadays, and I shouldn't even say them, right? Because the doctors are the ones that really do care about their patients. It's the organizations in which they work, or sometimes try to just create the numbers instead of that true patient care. So it's incredible to see you stepping out of that and really diving deep into the overall well-being of your patients. Was there, because you kind of touched point on why you started God Now, was there a specific patient story or moment when you thought, okay, the system isn't working the way it should? I really need to build something different.
That's funny you said that. I would never forget. So when I was still working, as I said, in cardiology, I did the beauty of what I guess it was more or less, as I said, that desire to do more. I just wanted to do more. I was bored, so to say. I did general cardiology for several years, and then during that period, I started cross-training with other specialties in cardiology. I did vascular, I did heart transplant, and things like that. I did electrophysiology. But when I worked in heart transplant, I think that's what really did it for me, because patients came in and they needed to have an LVAD. An LVAD is more like an external heart device if you're waiting for a heart transplant. So patients would come in, they're waiting for their heart, and some of them would get their heart transplant, and some of them wouldn't. There was this particular young African-American guy, I think it was in his 20s, like 24, 25. He had chronic heart disease, cardiomyopathy, meaning his heart was weak from several factors. He had irregular heart rhythm for so many years, and over time, his heart just got weak. So he came in waiting for a heart transplant. So I was one of his, I took care of him. So we got talking and everything, and, young guy. And then he went ahead and he was scheduled for the LVAD, more like a bridge towards a heart transplant. I saw him the day before. We spoke and everything, was wanting to connect back to his daughter. He was talking about dreams and hopes. He had the procedure. The next day I came back because I didn't do night shift. I did more of the ICU. And I was like, this person had this procedure. Okay. I was looking forward to see him, hearing that it was okay in the ICU or, CCU. And then I heard, he had complications. He had internal bleed. We lost the guy. I was like, I've lost patients before. And then, and I was like, okay, I think that was what broke the camel's back. Because when I lost him, I was like, what is this? What is this? What is this? I just felt upset. I said, how can we lose somebody this young? Stuff that could have been prevented. I've had patients that come in, men, they come into the emergency room with full-blown kidney failure, undiagnosed high blood pressure, or they want high blood pressure medication because they had erectile dysfunction from the side effects. They stopped taking their medication, and now they have, chronic kidney disease and they need, dialysis. I was like, no, this has to stop. There needs to be education. Somebody needs to go out there and talk to this patient. Somebody needs to listen. Somebody needs to sit down and figure out, Mr. Smith is not taking his medication. Why? It's not like Mr. Smith doesn't want to be healthy, but there's something else. What is Mr. Smith going through? Home environment, mental health, believe in himself. Is Mr. Smith depressed? There's just so many moving parts. Does Mr. Smith know how to eat well? Because you're telling him, stay on a low cholesterol diet. That's how we're taught. We're taught about general, do this and do that. But patients don't have the skills. They don't have the tools that they need. We need somebody to sit down and tell them, okay, this is how your plate needs to look at. This is how a low glycemic index, meaning staying away from high sugar fruits and vegetables. You want me to eat fruits and vegetables, but I'm grabbing watermelon, I'm eating grapes all day long. Those are not, they're great fruits, but they have a lot of sugar, natural sugar. So there's a lot of information that patients don't get. So I just felt the need to just go out there. I'm not going to save everybody, but if it's just one or two people that come in and their lives get changed, I think I've done something. So it was that patient that really kind of hit me,
It's, I think a lot of people in your profession have that story, right? That's why I ask it, because it's so, you always have that like aha moment in business, right? And or like you're sitting there and it's like, oh my gosh, this needs to change. And that was it for you. And it's, you bring up food, which is great because my mother always taught me, shout out to her, it has to be a colorful plate. Then you've got all the major food groups. If it looks all one color, it may not be the healthiest decision for you. And that was like the best advice I got going into college, right? So when you it kind of transition a little bit, but same, because you kind of touched point on it as well. Like when you look back at your younger, nurse practitioner self, what would she be most excited or proud to see about the work you're doing right
now? I think she'll really be proud of herself because, right now I have a couple of patients here and there, and I always hear them say something, that's kind of common through everyone that walks in, the women that walk in. Someone that listens to me. Finally, somebody's listening to me. Finally, I feel like, somebody cares about me. Finally, I'm losing weight. Finally, I feel like I'm not crazy. Finally, I'm diagnosed with what I thought I was supposed to be diagnosed, but now somebody has put a name to it. Finally, I can spend more time with my provider. So that's the common thing I'm hearing. All the ladies, they want to feel better, they want to look good, they want to feel like themselves again. So the patient that I saw before I spoke with you, she said, Sarah, you've changed my life. She was dating her boyfriend now, husband. She said, ever since I started hormonal replacement, I'm able to have a better relationship with my boyfriend, which led to the engagement. I'm having better sex. My mood is better. I have more energy. She's lost 41 pounds. She's great. She's like, Sarah, thank you so much. And that means a lot to me. I just felt like I'm doing what I was called to do. Like, this is my calling. Now I finally figured out this is it. This is where I need to be. And I hope to grow and do more, maybe train other people to do what I do. But that's really my core, to just prevent those chronic diseases, people from dying, really.
Yeah, it's an epidemic. Sad.
Yeah.
Let's see. The health and wellness landscape is shifting fast and dramatically. What is one big change you're seeing in how women want to approach their health today?
I think a lot of women want more than just going to their primary care doctor. There's nothing wrong with having a primary care doctor. I have a primary care doctor. There's only so much that primary care doctor can do. There's only so much insurance will cover. So I've noticed now that women, even men too, they don't want the conventional medicine anymore. Now they know they need that for when they're sick and all that, but they want more. They want something more holistic. They want somebody that listens. They want somebody that will prevent It's the prevention. I want to optimize my health. I want to prevent this. You know, I've been struggling to lose weight. I want to lose, you know, I want to lose weight. I want to get my energy. So that's what I'm saying. And the women don't mind stepping out of the office of the primary care doctor and having another person like me fill that gap, or just help them, you know, be another part of that care model where they're actually getting that holistic and overall health. So I see that a lot going on right now.
And how are you weaving things like hormonal health, metabolic health, lifestyle into care so it feels more whole person and less 10-minute visit and prescription outside of time spent?
Well, when patients come in, I spend like 45 minutes to an hour. I have a huge questionnaire that they complete before they come see me. So I look into that, you know, how much are you eating? How much exercise? How much are you sleeping? Do you have any stress? What is your stressor? You know, and things like that. You know, I go through a lot, and I go through the symptoms to the little details of the symptoms, you know, hair falling out, dry skin, you know, those are little symptoms of, you know, fine, they could be aging, but they could also be just poor health. You know, you're having headaches, you're having, you know, difficulty losing weight, you're always cold, those things. So I spend a lot of time, you know, looking at that, and then just finding out what they want. I usually ask them, what brought you in today? And then the next thing is, okay, this is your plan, but what is your why? Because you're going to have moments where you're going to want to give up, moments where, you know, fine, you're trying to lose weight to fit into a bikini body or to get married. But after all of that excitement is done, are you going to go back to your old lifestyle? So I try to I ask them, connect to your inner why, what I call the intrinsic. There has to be something deeper. So once I talk to them about that, they realize what it is. And that's usually the anchor that I use. Like, okay, when things get rough, we're gonna remember this conversation. So that's the approach, you know, getting that extensive history, doing a physical exam, and then finding out what else, digging deep, looking at their mindset, the thought process. You know, I'm checking everybody if they have depression or anxiety. We have to do that because women go through a lot of hormonal changes and mental, emotional changes, even men too. You know, let's address things. So there's a lot of moving parts. And then I develop structured plan and things like that that helps them. So I give them a lot more than what their primary care doctor would.
That you're delivering more value than anybody else out there. And the fact that you are diving deep into, you know, what are your goals? What are you going to do? And is this just a fad, quick, like you said, get into the suit, or temporary fix? We want to make this a long-term solution. I applaud you for that. There's just so much to be said about taking that holistic and backdoor approach to medicine where let's tie it all, let's find it out. Incredible. What does your care actually look like on the ground? Can you walk us through what a new client experience from first contact to feeling that unlayered transformation looks like?
Sure. So they come in, as I said, the fill-in, they usually go online. Most of my services, I'm 100% virtual. Occasionally I'll see patients in the office. So they usually come in, maybe they're referred or whatever. They come in, they fill out all the consent form, fill out the questionnaires, as I said. We have a discussion for about 45 minutes to an hour. I get all the information that they need. And then I order some labs. I do extensive labs. I do labs more than what the regular doctor would. I want to see what their body is doing right now. You know, if you had your blood, your A1C checked 3 months ago by your primary care doctor, I want to know what it is now. Okay, because things change. So that is usually my baseline. They come in, as I said, I check a lot about activity, sleep, and all those things. Once that is done, they come back again, I review their labs, plus the symptom analysis, and I develop a care plan for them. I have a couple of packages. I have 12-week packages, metabolic and hormonal optimization. Those are just for patients that really want, the holistic and hands-on. We're talking about diet, we're talking about meal plan, exercise plan. They're having weekly emails on, different topics about sleep, about purpose, about, connection, happiness. There's so many things that dribble down to the patients. And I support them. They meet with me every month, and they can meet with me sooner. They can text me, for questions. They have any questions, I check on them. How is it going? If I need to adjust their medication, because I'm providing the coaching, but also I'm managing them medically. We're checking labs often. We're reviewing how they're responding to the medication. We're increasing, we're decreasing. Once we get to a steady level, I keep them there, and they meet with me, quarterly or every 6 months to a year. So that's how the program is. I have different programs for different things. Some patients come in, they just want weight loss. But we know that weight loss is not only weight loss, right? You got to look at the metabolic, you got to look at the hormonal. But people come in, I want to lose weight. Okay, but let's check your hormones. Let's check what else might be going on. So that's the holistic part of it. And then the patients, depending on, what they can afford or what they're looking for. I never want to force my plan or my program on anyone. I'll meet you at where you are, but at the same time, I'll let you know this is what is going on with your body. If you don't do X, Y, and Z, this is what's going to happen. You told me that you can't sleep, you're tired all the time, you're grumpy, you want to feel your best. This is where you are, and this is where I want to take you if you work with me, in this journey together. So it's a relationship, it's a journey. It's not something that Rome wasn't built in a day, right? What's been going on with you didn't happen overnight. It took years. So the result is not going to happen overnight. It's going to take time. We're going to work together. And the goal is to get you to be the best version of yourself.
Partnerships, right? It's basically a partnership that walks you through.
Partnership.
I love that. You kind of had dropped a hint about, because you utilize it, right? And technology and virtual care are just absolutely a pillar of what you're doing. Mm-hmm. How are you using digital tools like telehealth or content to extend your reach beyond just the exam?
I do have some social media presence. I have I'm on Facebook. I try to be active. I'm still trying to be consistent with that, put my face out there. So I have Facebook, Instagram, LinkedIn. I'm on TikTok. But I'm more active on Facebook than anywhere else. It's just Facebook is easier for me, but eventually, but I am. If you Google my name or Google Unlayered Health and Wellness, you're going to see me in all those platforms. So those are the ways that I use to reach out to patients, reach out to people. I also occasionally will attend like vendor events or little podcasts like this, or just do events in my neighborhood, in my community, and just educate people about their health. And, when it gets warmer, I usually do like an unlayered walk. It's called Unlayered Walk with Sarah. I do it in my neighborhood. People come and they listen to maybe like a 10 minutes time. We talk about a topic about health or whatever. And then we walk around for like a mile or two. And then you're networking, you're exercising, you're getting fresh air. And then everybody goes home. So the different ways that I try to incorporate and also expand my reach and get the visibility.
Very big right now in trying to build patient care, and let's build what you're doing. We could really sit on a week at Unlayered, right? What would we notice you doing differently from a typical women's health practice or another practice that's in the same kind of niche as you?
I think what sets me apart is the fact that I go a little bit deeper in terms of I really want to know you. I really want to connect in terms of the mindset, the holistic part. I'm coaching you, because there's so many people out there that you can come in and get your HRT from the guy next door, or you can get your weight loss from the lady or online. But I provide you with that connection. I listen, I look at the whole picture. You know, you have customized care, you have access to me. It's just more, I see it more as a relationship, and I see it more as I want to help you. I want to understand and I want to know you, you know, as opposed to just, okay, come and get your medication and just go. I do a little bit more than that. Yeah.
As we own businesses and, you know, we're the entrepreneur minded people, you know, we all know we have that messy middle. What are the toughest challenges you're wrestling with in the business today?
Ooh, yeah. I mean, as a solo business owner, hopefully to expand, there's a lot. You know, when you were raised or trained in the medical field, you just know the medicine part. You just know, come take care of patients and go. But now that you're an entrepreneur, you're a business owner, there's a lot that I'm learning. There's a lot of sales, a lot of IT, AI. I mean, there's a lot. So I think the challenge for me is just being able to just understand the business part of it, and then know when to delegate and know when not to, because it's very easy for me to just do everything, you know, but I can't be everything. So I think that's the challenge, just, you know, getting the word out there, getting more patients, because I feel like I can help a little bit more, but then being able to manage, you know, the business part.
I was just on a podcast with somebody else, and they very much mentioned in the same context, right? Know when to hold them, know when to fold them. Like, you know when you can take on those responsibilities, and when, hey, I need to let something else do this. Either let the technology take over and run it, or I need to delegate this to somebody else in the office so that I can continue to focus. It's a common theme, it seems like, from everybody. From your perspective, what are the biggest gaps or broken pieces in the current healthcare system that make you work harder than it needs to be?
Broken pieces. Well, because I'm doing something different, you know, I'm not gonna shame the regular the medical care that is insurance based. I mean, I do accept insurance, but I've seen why insurance cannot be used for some more of what I do. So it's just the way the system is, you know, it makes it a little bit difficult. Patients come in and patients honestly want more from their providers. They want more from their primary care doctor, but it's harder for them to get that because the system is not structured that way, you know. So patients they're struggling, you know. The doctor doesn't have the time. 15 minutes tops, you're seeing a patient, you're going to the next. Here's a medication, you know, oh, let's go see that. You know, they're just putting out fires. So I think that's what I come across. That's the problem, because patients come in, they want more. And then when they get to me, they're like, oh, okay, this is all the things I need to do. And they feel good about it. But sometimes they come in with a lot of medical stuff that's being neglected. Or sometimes the patients don't even want to follow up with their doctor because they feel like there's nothing else that can be done, you know. So there's just a lot of little things that I come across. I think the main thing is the time. You know, physicians don't have the time. I don't think any physician that goes to medical school or a nurse practitioner that becomes a nurse practitioner just wants to take care of patients for 15 minutes and go. And, you know, we don't want to do that, but it's hard for us to do that because of the structure. So that's why, you know, a lot of other wellness practices are coming up to provide that care, to fill that gap. So
it also seems like you touched point on the time. I mean, you can only see so many people in a day, and it feels like the, you know, corporate medical world is all about how many times can I bill in that out, right? versus how many people can we, fix? How many people can we diagnose? How many people can we help mentally, physically, emotionally? They've taken that out anymore. So when you talk to other people and think, God, there's too much competition, it's easily reminded when you speak like this and say, there's millions of people. There's plenty of opportunity for anybody to come into this field, and let's show you how, because we're all learning it.
That's true.
If you could snap your fingers, right, and fix one thing, whether it's reimbursement, regulations, awareness, bandwidth, or anything in your practice, what would you change, or what would you change that would have the biggest impact on Unlayered and your patients today?
I think it's just the visibility. I want more. That's what I want from. If I could flick my finger, I want to see 20, 30 patients on my schedule that I'm helping. And then having the structure to attend to those patients. I think that's what I need right now, and that's what if I can flick my finger, I want that right away, and just have people coming in and just feeling better and getting the care that they need. I think that's really, really, what I want. Just having more patients come on. Yeah.
Fix more people. I love that.
Yeah.
Let's fast forward a few years, right? When you think about the future of Unlayered Health and Wellness, what does the most exciting version of that look like for you?
Unlayered Health and Wellness. The future. I have other providers working with me and just doing this together. And incorporating mental health person in the team. I'm incorporating maybe a fitness trainer, incorporating a yoga instructor, and things like that. So it's really a wellness space. You're getting your medical needs met, and you're getting your emotional and physical needs met also. Because I tell you exercise, but you don't know what exercises to do. You can come into the office eventually, if we do get a space, you can come in and get some exercise. There's a lot of ideas in my head, but I do want it to be kind of like a place where people can come in. As I said, most of my patients, 90 of them they're women. So place where women can come in and just get the whole wellness that they need virtually or, locally. Yeah.
Do you ever see that being accepted by the insurance providers where they all of a sudden jump on and it's more of an opportunity for them to take patient care to their next level and allow providers like yourself the opportunity more to have that flexibility and freedom within co-working with insurances?
Eventually, things change. I think now the insurance companies they're paying for a little bit of wellness. They call it, maybe a weight loss program or something like that. But I don't think they'll really provide the support that we really need in terms of the time, the time and the other, because everything has to go with guidelines and limited amount of time and things like that. So, eventually maybe, but it's going to take a long time. Maybe if there was another health plan that was carved out for just wellness, and just prevention of wellness, that will be good, as opposed to just sick care, just wellness, like, no limitations to wellness. Just have that covered by insurance. That would be great.
I would love to see something like that.
Yeah.
Let's jump 10 years from now, right? If a patient or a colleague is describing what you built, what do you hope they're saying about Unlayered Health and the way that you changed their experience of healthcare?
10 years from now, I want them to say, Unlayered filled the gap. Unlayered went over and beyond. Unlayered is what is needed for anyone that's looking for that holistic care, that's looking for that, if you want to prevent that, somebody that goes over and beyond, you're preventing, you're optimizing. Unlayered is who you need to go to if you really want that care. So I think that's in 10 years time, yeah, that'll be it. Yeah.
Be the go-to.
Bridging the gap and doing more than just checking boxes, doing more. Yeah.
That's incredible. Your efforts, what you're doing in the medical field, your separation from the standard and the norm to take a little bit more of a deeper, passionate look at patient care is absolutely incredible. Sarah, I think what you guys are bringing to the market with Unlayered is, very recognizable and notariable. So thank you from, patients to doctors. We are seeking different approaches. I can tell you that as a patient and a consumer. So definitely, I want to thank you. For those that are listening, what advice would you give them to do what you're doing and step away?
Advice to give other providers?
Providers, young ones coming out of college, entrepreneurial minded. There's so much, but what would you give in advice? Yeah, in the medical field to say, hey, look, break away, do what I did. It's worth it.
Yeah, I think, just face the fear. I mean, you're always going to be scared, just do it. Just follow your heart. I mean, it's in there. Your heart wants you to do more. Just follow it and just trust it. That's what I'll tell them.
Yeah. Trust it. Trust the heart.
Trust your heart.
I love that. Well, Sarah, thank you so much for joining us again. If you guys have any questions, you can always leave comments in our views. Again, this was Behind the Desk and In Depth with CEOs, VPs, business leaders, and innovators around the world. Thank you again, Sarah, for joining us.
Bye. Thank you for having me.